Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. This is Valley Health Minutes. Today we're talking with Dr. Kellee Boster about a consult clinic. What exactly is that, and how could it benefit your family? So we're excited to learn more. What exactly is a consult clinic?
Yeah, so a consultation clinic is a service that we offer at specific Valley Health locations, and it's an arm of our integrated primary care behavioral health service. And so what that means is a team-based approach among different disciplines, different providers, so behavioral health, psychiatry, primary care, and we work together to provide medication recommendations and behavioral health services and support together within one appointment.
So walk me through the process. You come in just for a checkup, and then you can end up with a consult clinic?
You sure can. So, for example, the most common way to get connected with Consult Clinic is to see your primary care provider at Valley Health, and then perhaps you want to seek out some psychiatric medication, some sort of psychopharmacological regimen in general, and your primary care provider might say, okay, well, how about we bring in some consultation of some experts in mental health, and then they would contact us. So I really like to explain it to people kind of like a triangle with a provider at each of the 3 points. So primary care, psychiatry, and psychology or behavioral health, which would be me or one of my colleagues. And so we all consult together and make recommendations and monitor the patient's progress, and also work on coping skills and really approach in a full mind-body sort of aspect.
And how does this benefit the patient?
Well, in lots of different ways. So one of the key reasons that it's beneficial is because it bypasses a lot of those lengthy waiting times that people often have. It is. And you know, with psychiatry as a specialty, it can be 2 to 3 months or longer to get in for an intake or an initial appointment with psychiatry. So it bypasses a lot of that and significantly reduces it. Patients, after you see one of us, a behavioral health consultant in the consultation clinic, usually can start their medications within 1 to 2 weeks and then follow up every couple weeks thereafter. And then research is really strong in support of the fact that when you combine both medication and behavioral health services together concurrently and work on that the outcomes are significantly better than either one of those two services individually. So we have a full, well-rounded approach to care.
And with better outcomes for patients, and that's important.
Yes.
What kind of conditions would this apply to?
Sure. A lot of common behavioral health conditions can be addressed. For example, depression, anxiety, post-traumatic stress, bipolar disorder, psychosis, things along those lines.
And this can get that team approach going and kind of get the process speeded up so you can get the help that you need. Is there a particular age for a patient in this kind of model of care?
Well, depending on the location, which Valley Health location you see, it's going to vary, but our behavioral health consultants can accommodate anywhere from age 4 all the way across the lifespan through older adulthood.
Can you describe what happens after that initial consult?
Typically, a patient would start a new psychiatric regimen in about 1 to 2 weeks and then follow up with the behavioral health consultant about every 2 to 3 weeks thereafter, monitor progress, response to medications, learn additional coping skills, apply those coping skills, and just do multiple different updates to the treatment plan and updating the primary care provider and psychiatry and adjusting the treatment plan accordingly.
And how beneficial are the results that you see?
We get outstanding feedback from our patients that have been involved in the consultation clinic, not only because of the reduced wait times, but oftentimes people get benefits that maybe they didn't even expect. Perhaps they had thought, oh, I just want medication, I don't necessarily want to speak to a behavioral health provider. And often they're surprised at the way that a lot of what they learn is generalizable to various areas in life and dealing with life stressors.
Yeah.
So
all the pieces kind of fall together.
They do.
Yeah. All right, Dr. Kellee Boster, thank you so much learning more about the Consult Clinic on Valley Health Minutes Day. Thanks for being here. We'll see you next Monday.